Welcome to This Explainer. Today, we're taking a really deep, eye-opening dive into the medications that millions of us rely on every single day. If you, or maybe someone you love, takes a daily blood pressure pill, well, you are in exactly the right place. We're going to decode the science, break down the hidden signals your body might be sending you, and get you the clarity you need to actually take control of your health.
But first, let me ask you something, and I want you to be completely honest here. If you've been taking Amlodipine, Lisinopril, or Losartan every single morning for the past year, how confident are you that you truly understand what that pill is doing inside your body right now? And I don't just mean glancing at the label or that one tiny sentence the pharmacist prints on the bag. I mean actually understanding how it works and knowing the warning signs that separate a minor inconvenience from a serious medical emergency.
The reality is, millions of really careful, educated people take these drugs on total autopilot. But listen, these medications aren't weak, and they certainly aren't daily vitamins. They are incredibly powerful drugs, designed to fundamentally alter how your heart, your blood vessels, and your kidneys function day in and day out. And when we take them blindly, we completely miss the vital and sometimes very urgent signals our bodies are desperately trying to send us.
So, here is our roadmap for today. Number 1, amlodipine and leg swelling. 2, Lisinopril's hidden dry cough. 3, Losartan and potassium risks. 4, the sick day plan. 5, hidden drugstore medication dangers. And 6, managing blood pressure without panic.
Let's jump right in. Section 1, amlodipine and leg swelling, a predictable reaction.
Picture this. We've got Walter, a super methodical 74-year-old former engineer. When his doctor added amlodipine to his routine, he figured it was just, a standard pill. But 3 months later, his feet had swollen up so drastically he couldn't even squeeze into his regular shoes. Convinced his circulation was completely failing, he immediately started Googling heart failure. He was needlessly losing his quality of life and just suffering in total silence.
And Walter's story brilliantly illustrates why understanding your specific medication category is absolutely vital. These drugs achieve lower blood pressure through entirely different biological doors. Think of it like this. Amlodipine is a calcium channel blocker. It actually relaxes the walls of your blood vessels, specifically the arteries. Lisinopril, on the other hand, is an ACE inhibitor. It blocks an enzyme that tightens vessels. So they might have the exact same end goal, but they use completely different mechanisms to get there.
So what exactly was going on with Walter? Well, it literally just boils down to physics and biology. Amlodipine relaxes those small arteries in your legs, right? It lets all that blood flow in freely. But the veins, the ones responsible for carrying blood back up to the heart, they don't relax in the exact same way. So you get this imbalance. More blood coming in than going out. It's like a traffic jam. Pressure builds, fluid gets pushed into the tissue, and boom, your ankles swell. This isn't heart failure. It's not salt retention. It is a completely predictable response to the drug that just requires a quick conversation with your doctor for an adjustment. Definitely not suffering and fear.
Moving on to Section 2, Lisinopril's hidden dry cough, the hidden tickle.
Now let's talk about Evelyn. She's a 71-year-old avid gardener. She developed this dry, scratchy, just relentless tickle in the back of her throat that kept her up literally all night. But here is the tricky thing with Lisinopril. The cough often doesn't start immediately. Evelyn's actually began 4 months into her treatment. Because she'd been on the pill for months without a single issue, she naturally blamed pollen season. She bought expensive air purifiers. She even got a chest x-ray. It just never crossed her mind to blame the blood pressure pill she'd been happily taking since winter. But once the doctor finally sat down and asked Evelyn to do the math, comparing when she started the pill versus exactly when that cough began, the mystery was totally solved. They switched her to Losartan, which is an ARB. It targets a very similar blood pressure pathway, but without causing that specific, maddening cough. Honestly, her 11 months of lost sleep and frustration were entirely cured in just 2 weeks.
But here is the absolute most crucial takeaway. We have to separate a nuisance, like Evelyn's dry cough, from a true medical emergency. If you are on Lisinopril and you develop a rapid swelling of the lips, tongue, face, or throat, you are experiencing something called angioedema. Now, this is rare, but it can close your airway incredibly fast. You do not wait until tomorrow. You do not take a Benadryl and hope for the best. You call emergency services immediately. Knowing the difference between a tickle and swelling can quite literally save your life.
All right, Section 3, Losartan and potassium risks, hidden risks.
You know what's really interesting about Losartan? A major danger actually comes from people just trying to do the right thing for their health. Think about it. A senior gets told to cut back on salt. So they go to the store and buy one of those heart-healthy low-sodium salt substitutes. Good job, right? Well, what they don't realize is that these products replace sodium with potassium chloride. Add in some electrolyte powders, a meal replacement shake, maybe a sports drink after a walk, and suddenly they're loading huge amounts of hidden potassium into a system that is already retaining it because of the Losartan. And the scary part? This creates a slow-building, super quiet threat. High potassium doesn't always scream at you. It announces itself subtly with unusual muscle weakness, really heavy fatigue, leg cramps, maybe some tingling in your hands, or a fluttering irregular heartbeat. If it goes unmonitored, this can severely mess with your heart's electrical system. So if you take Losartan and you use salt substitutes, you absolutely must make your doctor aware so they can keep an eye on your levels.
Section 4. The Sick Day Plan. Handling illness. Okay, let's talk about an environmental factor that hits all of us eventually, regardless of which medication you take: getting sick. When you catch a stomach bug, have vomiting, diarrhea, or even just sweat heavily during a brutal hot summer week, you become dehydrated. Your internal environment fundamentally changes. Suddenly, that standard, everyday dose of medication, it starts acting dramatically stronger. Your blood pressure can fall dangerously low, putting a massive strain on your kidneys. This is exactly why you need to ask your doctor for a sick day plan, way before illness strikes, so you know exactly when it's safe to hold a dose and when you really need to call the clinic.
Section 5. Hidden drugstore medication dangers. Risky combinations.
Now there's a huge, totally preventable trap sitting right in your local pharmacy's pain relief aisle. It's something so many people fall into when dealing with, just a bad week of arthritis or a stiff back. You head to the store, pick up some ibuprofen or naproxen. Perfectly ordinary NSAID painkillers. But when you combine those with blood pressure medications like Lisinopril or Losartan, and then add in even just mild dehydration, you're creating a massive risk for acute kidney injury. These pain medications meaningfully reduce blood flow to your kidneys, which completely compounds the strain your prescription drugs might already be causing.
The really vital lesson here is that your kidneys, they don't care if a pill costs you $5 over the counter or if it's a fancy prescription. They do not distinguish between them. They just respond to the chemistry. So, if you routinely use anti-inflammatory meds for joint pain while taking blood pressure drugs, please do not silently accept that kidney risk. Have a chat with your doctor about safer alternatives, like acetaminophen or maybe even physical therapy.
Which brings us to Section 6, Managing Blood Pressure Without Panic. Monitor, don't panic.
Let's talk about real, everyday life at home. We have to start with a symptom that is almost universally underreported because, well, it just feels too minor to even mention: dizziness. You know that brief, wobbly moment when you stand up quickly from the couch? That isn't just you getting up too fast. It's literally just gravity and physics. Your medications are doing their job. They're lowering your blood pressure, and when you stand quickly, gravity pulls that blood down, causing a very temporary drop in blood flow to your brain. Rising slowly gives your system time to catch up and compensate. But please, if this dizziness is persistent, you have to report it. For older adults, a brief dizzy spell can cause a fall, and falls cause life-altering hip fractures. It's a chain reaction, so don't ignore it.
And finally, let's look at that home blood pressure monitor. Blood pressure is not some fixed, unchanging number, right? It fluctuates constantly based on how you slept, how much coffee you drank, or even if you're talking. A single high reading on a random Tuesday morning absolutely does not mean your pill is suddenly failing. We need to stop acting emotionally to these random spikes. Instead, gather genuinely useful data for your doctor by testing the right way. Rest quietly for 5 minutes beforehand. Always use the same arm. Test at the same time every day. And whatever you do, do not talk while the machine is running. Let real patterns, not panic, guide your medical decisions.
So, I'll leave you with this final and probably most important question to think about today. These medications, they rely on a steady, consistent presence in your system. They are not rescue drugs you just pop when you're feeling stressed out. So, are you letting your medication manage you in the dark? Or are you finally ready to step into the light, understand the science, and actively manage your medication? Take this knowledge, partner up with your doctor, and really take control of your own health story. Thanks so much for learning with me today.